Today we will discuss what medications have to be there when we are treating a case of heart failure. Especially, first we will discuss about heart failure with reduced ejection fraction. So, as we know, in case of heart failure with reduced ejection fraction, there will be congestion. So, for decongestion, we can use diuretics. We have to use diuretics, or we can also use nitrates. That will also help, especially in case of acute pulmonary edema. So, that will help for decongestion. Next one is, as we all know, whenever there is reduced ejection fraction, that is, it will lead to decreased cardiac output, which will lead to decreased blood flow to the kidneys, which will activate RAS system. So, this RAS system will cause arterial vasoconstriction and decreased GFR, through which it will try to conserve, it will try to improve the cardiac output. But over long run, that will be detrimental. So, we have to inhibit RAS system. So, for that, we can use ACE inhibitors or ARBs or ARB can be used. And next comes beta blockers. So, again in heart failure, there will be decreased blood flow to the carotid baroreceptors, so which will activate the sympathetic system. Through this activation of sympathetic system, there will be increased heart rate and venoconstriction. So overall, this will lead to increased cardiac output. So that is trying to compensate in the initial stages. So, but over long term, this overactive sympathetic system will be harmful for the cardiac. So we have to block that sympathetic system using beta blockers, which will control heart rate. So, as we all know, especially in case of heart failure with reduced ejection fraction, there will be neurohormonal modification. So we have to antagonize that. So what we are doing? Neuronal antagonism through beta blockers and hormonal antagonism through RAS antagonists. And fourth one is, again, long run of decreased blood flow to the kidneys will lead to RAS activation, which will again increase the levels of aldosterone. So this aldosterone is the factor which will cause endothelial dysfunction in the cardia, also myocardial fibrosis, which together we can consider as cardiac remodeling. So this aldosterone has to be antagonized. So for that, we can use aldactone or spironolactone. So these things should be there in the list of medications. Fifth one is SGLT2 inhibitors. So nowadays, in case of heart failure with reduced ejection fraction, you might have heard about dapagliflozin. So that is SGLT2 inhibitor. Through various mechanisms, dapagliflozin is beneficial in case of heart failure with reduced ejection fraction. So we can consider these things as the pillars of heart failure. So this is about heart failure with reduced ejection fraction. But what about heart failure with preserved ejection fraction? That is HFpEF. So in that case, actually, there will be maintained cardiac output. So there will not be decreased cardiac output. So it will not lead to what? Activation of the RAS and activation of the sympathetic system. So neurohormonal activation will not be seen in heart failure with preserved ejection fraction. But it is a state of heart failure. So what we have to do? We have to help the heart to reduce its preload and afterload. So what we can do? We can use again diuretics for decongestion. So that is one drug which will be beneficial in heart failure with preserved ejection fraction. Second one is, we can use aldosterone antagonists. So this one, as I already told, is the main factor causing heart remodeling. So again, in heart failure with preserved ejection fraction, we can see ventricular hypertrophy, in which myocardium will be, myocardial fibers will be abnormally arranged. So that we have to prevent. So again, aldosterone antagonists are beneficial in heart failure with preserved ejection fraction. And next one is, they have also approved dapagliflozin, that is SGLT2 inhibitors in case of heart failure with preserved ejection fraction, because as we discussed already, that drug will act through multiple mechanisms in case of heart failure. So that is again beneficial for heart failure with preserved ejection fraction. Do read more about the pathophysiology of both reduced ejection fraction and preserved ejection fraction heart failure. Then you will get to know the importance of these medications. Thank you.